We wrote that introduction. It doesn't come as a surprise to anybody. Just to know that I'm being sent up to Washington with the heavy responsibility to represent our people up there is, well, it just means a lot. It means a whole lot. And I'm very proud that you all sent me up there, and I thank you for it. I think, first of all, that it's awfully nice to be home and away from Washington. I'm sad to report to you that I have to go back tomorrow. We're starting up again with the session tomorrow. But this has been a lovely 2 weeks to be home, and boy, it really rejuvenates you when you're in Kentucky in the springtime, doesn't it? I mean, if there's a prettier place, allergies aside, if there's a prettier place in the country, I don't know what it is. As you know, I guess there are different ideas about exactly how we got into the situation that we got into, but in 2008, September of 2008, we had what amounted to an enormous meltdown in this country. Consumer confidence just fell to rock bottom almost overnight with the banking crisis, and I think that came on the heels of the gas prices that summer going through the roof. I think that shocked a lot of people's systems, and then when the banking crisis hit, people just shut down all over the country, and there were a lot of manifestations of that, of course, in lending practices and so forth, the availability of money, a lot of manifestations. But Congress at that point had to make a decision about what to do to keep the country from going into what I think most commentators would suggest to you would have been a full-scale depression. And of course, none of us wanted that. What the Congress did was the Congress passed a major bank bailout bill. I voted against it for a number of different reasons, but the Congress passed it with the belief that something had to be done, and I think something did have to be done to arrest the failure of all of these banks. And it gets us back to some deeper questions about why we should have, or whether we should have, institutions in this country to begin with that are too big to fail. That's a question that a lot of people have asked for a long time. My own belief is that it's bad for the country to have institutions that are too big to fail, and we ought to do what we can to limit the size of those institutions. And there's some legislation that's getting ready to go through. I think that's the next big thing we're going to be talking about is legislation related to the banking system. None of that's been talked about, though, to any great significance, or none of that's been heard by the general public in the last several months, because everybody's been talking about health care. Health care has sucked up all the oxygen in the room. That has been the topic of conversation, and as I'm sure you all know, anybody who knows anything about health care knows that it is a supremely complex subject. There really are no subjects that I know of that are more complex than healthcare. Even economics, I don't think, is any more complex than healthcare. And I'm not sure that any of us know what the real answers are to fixing our healthcare system. I'm, in fact, not sure that you can ever totally fix the healthcare system. In fact, I'm pretty confident that you can't. You can decide which way you want to take it. You can make determinations about the direction you want it to go, but to fix it, that's another question altogether. The problems are obvious, I think, and there are two particularly significant problems. One is that we have, up to now, not ever made a decision in this country to cover everybody. Most other industrialized countries in the world made that decision a long time ago, that they would cover all of their citizens, and they felt like that was a moral decision that they needed to make. We have not made that decision. We've come close to it with this health care bill that's just passed, but prior to that, we had not gone there. The second, and I think every bit as significant issue with health care, is the cost. The cost that this society, our society, bears for our healthcare system, which is about twice what any other system pays for their health care. Any other industrialized nation in the world pays. Twice what they pay per capita. Now that's, some are a little bit above that, come a little closer than half of what we pay. But in general, we pay twice what any other industrialized country pays.
Oddly enough, and this is one of the problems, I think, with the war effort, not enough of the country is affected by the wars. And I think we'd be better off if more people had to sacrifice. We would have a better sense of the fact that we were even in wars. Unless you have a family member in the military, you really don't see a whole lot of what really is going on. It's almost hidden from you. It's like the country isn't really at war. You've just got this professional army over here that you've sent, and it's at war. And it shouldn't be that way. The whole country ought to be bought in, I just think that's important for the country to be bought in if we ever do anything like that. And from my point of view, the quicker we get the kids home, the better.
From your vantage point in Washington, as a citizen of Kentucky, are you concerned about the horse industry? We hear a lot about it and the gaming issue. What's your vantage point on that?
Well, I am concerned. I am a supporter of the horse industry, and I support it because of the jobs that it creates. It's not only does it create jobs in central Kentucky, it also contributes to the beauty of the landscape, which we're all, I think, very, very proud of. The horse industry needs help, in my view, and I think we ought to do everything we can to help.
5 years ago,
Well, it was